Part 2, General Treatment. This lesson is 10 minutes. Dr. Krejko will discuss nasal hygiene steps to achieve and maintain clear nasal passages to promote unrestricted nasal breathing.
Now we're going to go on to General Treatment, Module 2. And our goal, of course, is to open and clear the nasal airway. This is something that once we broach that part of the discussion, it seems fairly straightforward. But what surprises me is how many people think this should be done with pills. And it's not that pills won't work or that pills can't be effective, but pills definitely have a higher incidence of side effects. And there are other techniques that a person can do. One, of course, is blowing your nose. Blowing your nose, getting the debris out, is very important. And that's one of the most important general treatment concepts, because there are people who don't realize that when you don't blow your nose or don't remove the debris from your nose, that you're actually leaving in there tissue that is already degrading. And in so degrading, it's actually stimulating more problems inside the nose as well. So whatever that mucus is that's formed, when it stays there, it is producing an opportunity for more growth of bacteria, for more stimulation or release of irritant material, and creating the opportunity for a person to have further clogging of the airway. So the concept of blowing the nose, though, can go through greater and greater sophistication. Obviously, you can squirt nasal saline into your nose. And just by squirting nasal saline into your nose will produce some results. You could go further. You could do what are called sinus rinses, which are usually salt and bicarbonate solutions that in modern times seem to be a very big market, and there is some evidence for their utility, that they will further assist in either eliminating the debris or shrinking some of the tissues if they're inflamed, and helping for better drainage and therefore ultimately clearance. Now with both of these, you can also use the neti pot, or the little teacup apparatus that goes in one side of the nostril. You tilt your head the other way, it now drains out to the other side by having gone up and around the passages and then coming out. That can be very effective for saline or for sinus rinses. And in our clinical experience with patients who have problems with nasal congestion, what's quite remarkable is that this may be all they need. I have seen innumerable patients, such as yourselves, who have come to us with these kinds of problems, and this is all they did, everything was cleared up. And I'm talking about people who've had allergies for years. And that shows you the power of this idea of clearance. If you're actually removing tissues and mucus and so forth that has built up and clogged this area, just by removing it, you're getting the tissues a chance to experience, clean air or clearer air, and you've removed the debris that also is causing irritation. This is extremely important as a first step, but what's often misunderstood is how often you can do it. A lot of people will think, oh yeah, I did that. So you ask, well, how often did you do it? And they go, oh, well, I did the saline a couple times last week. And that, it's a good start, but the person may not appreciate that you could actually use saline 10 times a day. You could squirt saline up into your nose 10 times a day, assuming that doesn't cause you a problem. And we'll talk about the side effect of that if you did it too many times. But you could clean your nose out 10 times a day. In fact, in my own personal experience, I can tell you that the way I treat a cold, I happened to get one for the first time in several years just a couple months ago when that big outbreak was occurring. I treated my cold with very regular saline washes. I wanted to remove as much of the debris as I could, as often as I could. And I think that it helps to reduce the intensity and the duration of the cold. So you have to find the right frequency of this for yourselves. And when a person becomes very stable with the nasal breathing being normal and the congestion is essentially gone, they may find that they wake up in the morning, they clean out their nose. Before they go to bed at night, they clean their nose. And that's it. And they don't have to do much during the day, even if they have a problem with allergies, if this was the only treatment that they needed. There may be other treatments, we'll get to those. Twice a day is not a lot to ask, but it is in one respect. Many people do not like to put things up their nose. And it's akin to the concept of, not the same, but akin to the concept of a diabetic. A diabetic who must use insulin has to overcome that hurdle of how am I going to learn to actually inject myself with a needle. That's scary for a lot of people, or it's painful, whatever it happens to be. And you have probably already tried these yourselves, and you're probably aware that some spraying can cause burning, or some spraying can cause some discomfort, maybe even pain. And that then could be a very good reason where it wouldn't be a surprise when someone would then say, well, why can't I just take a pill? Can I just take a pill? And that's not unreasonable. And I've seen some patients use the pill form and get a pretty good response. But I'm just want you to be clear, from my perspective, these are much better if you can learn to use them. And most people will discover that burning sensations, pain, discomfort generally subside. It's something that's much more likely to occur, I think, when you're having the problem and you're getting used to the idea of trying to clean things out. So that is a barrier, but it can often be overcome. And when it is, then the individual actually has the potential to be able to do this every single day. And that's what's very important, that the person wakes up in the morning and says, I need to take care of my nasal hygiene. Nasal hygiene is about opening and clearing the nasal airway. Nasal hygiene is something you can see from the discussion so far is it could take 30 seconds in the morning. It could take 90 seconds. It could take 3 minutes. It could be something you do in the shower, and you're done with it. So getting people down that pathway at the sleep center, you should see the smiles on their faces when they come in and they talk to us and say, well, I did this. I did just what you said. And it's remarkable. It's unbelievable. And they say, and I'm already sleeping better, which is quite interesting in terms of all that we're going to talk about, because it's true. If you make the nose clearer, there is a chance you're going to start sleeping better just from that single step. And let's go back now to what I said in the beginning about not being able to detect what normal nasal breathing is. Of course, now, once you do some of this, a person begins to develop a new definition. But keep in mind, before that state, people don't want to do this because they're not paying attention to it. You may not think this is important. You may think this is not an important step in the treatment of your sleep problems. And I want you to know that sleep problems, in many senses, for many people, begin right here, begin at the nose. There are other general treatments that we'll talk about, different types of things, as I mentioned, medications, other sprays, and so forth. But that is the summarizing point, that you have to be very aggressive with the idea. It's okay to work with your nose. It's actually better, safer, less side effects than taking other types of medications, and that the results can be very dramatic and fairly quick, within a couple of days, within a week, if you apply yourself. And virtually all of it can be self-taught.